Welcome to G.A.M.E. Gross and Microscopy Explained. Do you have any idea of the couple of pictures on either side of the screen? Well, they are the peripheral nerve sheath tumors and the peripheral nerve tumors. Both of these are a little difficult for the students but easy once you are able to identify them. The importance of these are given in the enclosure. There are two types of peripheral nerve tumors. One is a neurofibroma, another is a schwannoma. These are diagrammatic representations of the tumors. So this is a peripheral nerve and you find that there is a tumor arising within it, which is called the neurofibroma. The nerve itself appears inflated and ovoid in outline. Sometimes it can be plexiform and hanging. This is a neurofibroma. Whereas there is another tumor which is eccentric and to the side. It arises from the nerve sheath. It is called a schwannoma or neurofibroma. Both are the same and you need not get confused. First, let us deal with schwannoma. It is a benign peripheral nerve sheath tumor, encapsulated, and commonly arises from the 8th cranial nerve. It is a soft tissue lesion and the spinal cord is another site where we can get it. Its malignant counterpart is called a malignant schwannoma. There are some other tumors which can have a similar appearance, such as the meningioma. It can be either sporadic or sometimes it will be associated with multiple neurofibromata. And look at this picture. It is an ovoid tumor and I am finding the nerve on either side of it. It is fixed. So what will happen when you palpate also? It will be mobile in only one direction, whereas it will be restricted in the direction of the nerves. This is a classical diagnostic step for schwannoma or neurofibroma. And beautiful diagrams. This I would like you people to draw in your theory. The source of it is given over here. In a case of a neurofibroma, it arises from within the nerve bundle, as a result of which the tumor itself is largely spindle shaped. A normal nerve, the tumor, and then again the normal nerve. You find that there is a spindle or an ovoid shape. And this is a cut surface of it. Multiple nerve fibrils are found within. Whereas in the case of a schwannoma, it is eccentric, arises from the nerve sheath, and it is encapsulated. This is how the cut surface will appear. This is something that we will have to remember. In a case of schwannoma, there are two types of cells, and one is called a cellular zone. This is a cellular zone, and all of these, always remember the pink color is the cytoplasm and the blue color is the nucleus. This is a diagrammatic view, and I find that all the nuclei, they are as though regiments of soldiers that are standing in an army. This we call a palisading arrangement or a parallel arrangement. So multiple bundles of these fibers are seen, and this is called a Verrocchio body. Verrocchio body can be asked as a question. When you do answer, you score a mark for it. Remember nuclear palisading, and this is a cytoplasm. And coming to the slide proper, there are two zones as I had mentioned. One is called the cellular area, otherwise the Antony A area. And the other area compared to this is relatively acellular. This is called the Antony B area. Here, as we had explained earlier and as also shown in this diagram, I find that there is an attempted palisading. and this is the extensions of the cytoplasm that I am seeing. Whereas this area appears edematous, I am finding a few lymphocyte-like cells and occasional blood vessels. So this will be the Antony B area and this is the Antony A area. So the description, this is what I would like you people to draw in your theory answers as well as the practicals. It shows cellular and acellular areas, Antony A areas, where you find bundles of elongated cells. There is a palisading arrangement of the nuclei. Also seen are anuclear areas. And these are the Verroque bodies within. So this anuclear area is actually the cytoplasmic extension. The tumor as such has got indistinct cell margins and the Antony B area is relatively acellular. Compare this with this. So relatively acellular. Edematous. How do I say it is edematous? The cells are all getting separated. So it is edematous. And sometimes there can be thick and hyalinized blood vessels. These are the diagnostic features of a schwannoma. Rarely you may be seeing hemorrhagic and cystic areas of degeneration. This kind of a field can be focused for you in the microscope. So you find that there are palisading arrangement of the nuclei and the cytoplasmic extensions which are eosinophilic. The malignant counterpart of this is called the malignant peripheral nerve sheath tumor. And the marker for these will be the S100 protein. Please remember this. Neurofibroma. This is a picture that is taken from a lesion from the floor of the mouth and the British Medical Journal of Oral Health has been the source. This also is a ovoid lesion. Most of the nerve tumors will be ovoid because they arise from a linear structure. So it is ovoid, well circumscribed, but I won't say encapsulated. And the cut surface is somewhat whitish or gelatinous in appearance. Sometimes it can be yellowish white in appearance. So this is the condensation that I'm seeing outside. So elongated tumor, etc. In the examination, you will be given a slide, not a specimen. But for completion, I am saying this. They are circular or ovoid bodies abutting the nerve, pinkish yellow to yellowish white. And the movement is restricted due to the direction of the nerve. In fact, they are perpendicular to the nerve, the motility. And they are mostly encapsulated because of the condensation. This is a slide for you people. In this, I'm finding slender cells and slender nuclei. Look at this one, very delicate fibrils and then a nucleus. And what I'm seeing as colorless is a stroma. Edematous spindle-shaped cells, wavy nuclei, slender wavy nuclei. If you are not impressed with it, see this picture. See this one. So obviously one thing that is striking me is the wavy nature of the lesion. And it is not composed of stout cells. They are very delicate and elongated tapering nuclei. The tumor is not encapsulated, but there can be condensation, ovoid or circular. Sometimes it is plexiform. Usually it is a localized lesion, but sometimes it can be diffuse. It can be multiple. So this is a condition of a neurofibromatosis, pleural. And another lesion that can be seen will be the cafe au lait spots. Coffee-like spots can be seen. So superb, nothing else is needed for you people. Even a low power, you should be able to make a diagnosis. One thing that is striking is multiple spindle-shaped cells which are haphazardly arranged, slender fibroblast-like cells. They can be admixed with the Schwann cells or the mast cells. Wavy nuclei, pointed ends, and the stroma is ground glass. Sometimes it can show a myxoid degeneration. This is an answer that you can very well write in your theory also. So please compare both. I am finding this is a picture of a schwannoma, this is a neurofibroma. cellular areas, acellular areas, palisading arrangement. In this, wavy haphazard cells with slender wavy nuclei. See you in game 25.